Hello, everyone. This is Dr. Rohit from Nepal, and today I wanted to talk about cancers. So, cancers are one of the very much deadly disease that a humankind can have, and there are reasons that we get cancers. Sometimes it's genetics, and also almost all the time, like out of that, it is the factors, the things that we are exposed to in day-to-day life, right? And so there are these things that are very much avoidable to reduce your risk of getting one of these deadly diseases. So what got me into this is currently I'm involved in a research about cancer, and during my reviews I found out that the incidence has been increasing very, very, very highly. And there has been yes, we have been performing this lots of tests that could lead us to diagnose the hidden diseases that are out there in the society. But the matter of fact is that we cannot avoid the thing that there is this lots of carcinogens that are increasing the rate of cancers. So I would like to start with this sun rays. So sun rays are definitely good for vitamin D, but exposing your both cheeks for 15 minutes a day, that's a standard uh, for you to get an adequate amount of vitamin D from the sun. Other than that, there's time period where you are supposed to not be on the sun. This starting from the 10 a.m. in the morning to the 4 p.m. in the noon, you are supposed to avoid getting exposed to the sun. And most of time, and the sun protective films are there. SPF 30 is very much enough for you to avoid the harmful rays that comes from the sun. Above that, SPF 40, SPF 50 are not recommended to use for anyone unless you are diagnosed with some rare disease like vitiligo or like xeroderma pigmentosum, amongst others. So SPF 30 is very much enough. And what's the standard is if you are, for example, going out in the sun or having the sun bath, you're supposed to apply sunscreen 2 hourly. So that's the standard for you to avoid getting your skin exposed to the harmful rays that comes from the sun. And the next thing is the cigarette smoke. When one talks about cancer, a doctor cannot avoid talking about cigarette smoke, because I cannot emphasize more on this, as there has been a very high increase in youth getting into this habit of smoking cigarettes, and this is very much detrimental to the health. This cigarette, we have this factors known as carcinogens that causes cancers in our body. And matter of fact that the cigarette, it contains more than 60 to 65 carcinogens. So when you are smoking cigarette, yeah, you can imagine that it increases your risk of getting cancer by what kind of quantity, what kind of numbers. So avoid smoking, to not smoke. That's number one thing, because the one who smokes has a high risk of getting cancers in any part of the body, be it this oral cavity, be it this throat, this nasopharynx, esophagus, this gastrointestinal tract, stomach, kidneys, urinary bladder, lungs, and whatnot. So avoid smoking, be it the first hand, second hand, secondary smoke, primary smoking, passive, active, any kind of smoking. Just avoid that. And the next thing I would like to focus is on there's other things like alcohol, right? So you have this increased incidence of getting cancers from alcohol, that are cancers of your gastrointestinal tract. Your breast cancers are increased incidence of breast cancer with alcohol. So breast cancer, also talking about breast cancer, having no child in your lifetime, or having a first child late in your lifetime, is also one of the risk factor for cancers. The hormone replacement therapies are there. So these are the avoidable factors that when avoided, reduces your risk of getting the breast cancer. And feeding, having a child and breastfeeding are protective for breast cancers. Yes. Likewise, I would also recommend you to avoid have a healthy food, uh, avoid junk, avoid eating out too much, because this increases the risk of cancer. When about eating, I would also like to talk about this edible oil that is out in the market. So whenever you are going to get an oil, take for yourself the oil that is non-hydrogenated. I would focus on this. See for the label that the oil is hydrogenated or not, because non-hydrogenated oil is very much important to reduce the risk of getting this cardiovascular diseases, like stroke, like microinfarctions, heart attack, brain attack, likewise, right? And next thing is regular exercise. It puts your immunity and reduces your risk of getting cancers. And I would like to focus mostly on this. We have these standard screening schedules in developed nations in the world. But during my work as a doctor here in Nepal, I have not seen so many people knowing about this. Yes, there are this standard screening tests that you are supposed to do for everyone, right? So to avoid this risk of getting cancers. So when you are females are 21 years of age, they cross this age, you start to get the test pap smear 3 yearly, up to the 65 years of old, because this 21 to 65 years of age is what you are supposed to have. This is when you are supposed to have this pap smear test 3 yearly, and after that, if you are recommended. And also this breast mammography test are recommended for the women from 50 to 74 years of age. That should be performed 2 yearly, and like before 50 years of age, if you have personal or family history of breast cancers, you're supposed to do this colonoscopy test. Everyone, these tests are for everyone, right? So you're supposed to do colonoscopy test from 50 years. Lately, the criteria has been changed to 45 years of age. Screening colonoscopy is recommended after 45 years of age for colon cancers. So there are these tests that you are supposed to do. Every one of us are supposed to do to avoid getting these common cancers, the breast cancers, the colon cancers. These are one of the deadly cancers. And also, if you are exposed to smoke and have this pack year, we call this pack year of smoking for more than 20 pack years, then you're supposed to screen yourself from the 50 years of age. You're supposed to screen yourself with this low-dose CT scan of the chest to see if you have long nodules that could be suspicious for cancers. Yes, and others, like I work in a general OPD and would never miss a chance to talk to the patients about these things. And like I see cases from wide range of ages, right? So there are this pediatric age group, this adult age group, elderly, adolescents, every kind of male, females. I come across this patient, and I would always take out time to educate them about this screening test. And when I see pediatric age group, I would want the parents to know that there are the standard vaccination schedules, like human papillomavirus (HPV) vaccines. Could be provided to the children after 11 years of age, maybe be it a male or a female child. So They could be vaccinated with the HPV vaccine and have their chance of getting cancers from human papillomaviruses reduced as a whole. Yes, these are the things, and counseling is always here. I would like to recommend my fellow doctors to always take out time for counseling, to talk to the patient about these things, because a one system and a one voice is, not very much enough every time to make a change. But the support that follows after is what is vital, plays a very valuable role to bring about a change as a whole in a reality. So, and that's it. Let's focus on the cancer-free environment. Let's avoid getting cancer. Let's take these simple measures to not get cancers. Yes, have a great day, and let's avoid cancers together.